So the next item is myocardial infraction causes, clinical presentation and prevention. That's going to be anchored by Dr. Abdullah Yusuf, consultant plastic surgeon, OAU, THC.
Assalamu alaikum wa rahmatullahi wa barakatuh.
Wa alaikum salam wa rahmatullahi wa barakatuh. Dr. Saab, you have 1 hour. You have 1 hour.
Ashhadu an la ilaha illallah wahdahu la sharika lah wa ashhadu anna Muhammadan abduhu wa rasuluh. Amma ba'du, fa'udhu billahi minash shaitanir rajim. Bismillahir rahmanir rahim. The respected Amir, the respected Sadar, MAJLIS ANSARULLAH, members of the AMILA, and my respected elders. The topic before me this afternoon is myocardial infarction, causes, clinical presentation, and prevention. As a way of introduction, myocardial infarction is a life-threatening disease condition. It is known colloquially as heart attack, and I think most of us are we most commonly understand it as that. It occurs as a result of death to heart muscles, and this usually is as a result of reduced oxygen supply to these muscles. The heart is an organ in the body, and most of us will often point to our left upper part of the chest, which is usually where the most part of the heart is, and it also extends to part of the central heart. I think this location is very important because when we are talking about the symptoms and how it presents, we can really appreciate why those symptoms are located to those parts of the body. The heart serves to pump blood to all parts of the body. The part of the heart that does this is the muscles. Because it pumps the blood, it's mainly made of muscles, and these muscles are called myocardium. Hence, from the word myocardium, we got the word myocardial infarction, which literally means the death of the muscles of the heart. Because the heart works so well, it's the muscles in the body, is the muscle in the body that work the most. By the time the heart stops working, that means the person stops living. Hence, the heart tends to work continuously, only relaxing, just temporarily, beat again and relax. Because of this, it requires a lot of oxygen, a lot of nutrients, and these are taken to it by blood vessels that are also located in the heart. These blood vessels are mainly the coronary arteries. We have the 2 coronary arteries. Usually, we are all familiar with the heart. It's an organ. Sorry, I do not have a picture here. It has 4 chambers. The 2 of the chambers are in the right. The 2 other chambers are in the left. So we have 2 coronary arteries, right and left coronary arteries. So they divide. So these coronary arteries are like pipes. We should just look at arteries like pipes. So if you have a pipe that conducts water to you, anytime there is blockage in that pipe, you definitely will not have water at the distal part, that is at the next part. Hence, the same thing happens here. When the heart pumps out blood to all parts of the body, including the brain, it also pumps blood to its own self through these coronary arteries. Hence, it uses this to this content of the blood, which are mainly oxygen and the nutrients, are what the heart uses to generate energy. And energy is what is always called life, because if there is no energy, nothing can function. So anytime there is a narrowing or blockage to these pipes, there is what is called ischemia. Ischemia means blood is not getting to a place, and hence there will be pain. We are going to be explaining more about this pain. I'm going to be explaining more about this pain. And this is a way Allah has used to protect us. Anytime one has pain, pain is somewhat protective. It tells us that there is danger somewhere. Hence, we have to act. So this ischemia, if it goes on for a long time, for a considerable time, sometimes as low as 20 minutes, sometimes maybe more than that, it's going to lead to death of that part of the muscle that the vessel supply. Why I try to explain this is so that we can understand what really happens and why we get the symptoms we get. Hence, if we have this situation, the reduction in blood supply to that part of the heart, I have mentioned that we are going to first of all have ischemia. Ischemia means that there is no blood getting to that part, and hence the next thing is that the part of the body tends to try to survive for a period of time until the insult gets to a certain limit that death will now come up, and that is what is called infarct. And anything that is dead does not come back like human being. As far as we are concerned as Muslims, we do not believe that there is anything like resurrection, that somebody that is dead. So if we have a part of the body which the heart is inclusive, and even the brain that is dead, it is dead. So there is no coming back for that part. So depending on the amount of the heart that is dead will now determine what the prognosis, what the outcome of this is going to be. So, however, apart from the fact that the vessel can be narrowed, if the demand on the heart goes beyond what the heart can take, especially in our more elderly people, well, serfdom may be associated, but most often in the more elderly people, the serf awal or the very elderly, we should not go ahead and do things that exert ourselves beyond our limits. Because if we do this, even though the vessels may not be narrowed, there may be danger. That is what that last statement is talking about. Then epidemiology. That is how is this disease distributed? How often, commonly, do we see this? The exact prevalence of myocardial infarction or incidence of myocardial infarction is not known, because most of the patients tend to die before arriving at the hospital. Hence, we may not be able to say what the exact number of people are. However, in the United States, it is said that about 1.5 million of people have myocardial infarction annually. In our own environment, it is more difficult to say, because data is one of the things we are lacking, and most people that have this may not even present to the hospital, and at the time they are presented to the hospital, they are no longer alive. But what has been shown is that the rates or the prevalence is increased more recently, because people are turning more to westernized lifestyle. We see sedentary lifestyle, even the diet we take, most of these are westernized. And all these have effects when it comes to the risk factors in myocardial infarction. I will be explaining more detail about that. Annually, we realize that about 12 million of people die from this disease, and like I've mentioned, about 50% of them of this death will occur before the patient gets to the hospital. Males are more affected, and maybe that's why death one of the reasons, because there are other reasons that death is more common among males. But however, when it gets to the age of 70, the prevalence or the incidence tend to converge. Hence, we have this gender disparity. Until about 70 years, men are more affected. The issue with myocardial infarction is usually seen more commonly around people that are 60 years, like I mentioned, the serfdom, but recently, the serf awal, recently, serfdom, or people that are lower than 60 years, 55 years, below, we realize that people tend to have myocardial infarction. Hence, even those that are younger, The moment one is a member of Ansar, we should beware. And alhamdulillah that we had a checkup this morning. That is one of the ways we can prevent this disease and some other diseases too. We go to the causes and risk factor. The main cause of myocardial infarction is the coronary artery disease. I mentioned to us earlier on that the artery that supplies the heart is called the coronary artery. So when this artery is diseased mainly by atherosclerosis, what it just means in simple terms is that there is narrowing of this artery. So this narrowing is usually as a result of deposition of plaques. And these plaques are mainly as a result of high amount of cholesterol in the body. Hence, this has been termed as one of the important risk factors. And one of the ways to prevent it is to do a checkup on this and also to use some medications in order to normalize the amount of cholesterol in the body. Other things usually that are risk factors to this coronary artery disease, like I mentioned, I said the coronary artery disease is the main cause. So we have, because there are other non-coronary syndrome, myocardial infarction, but the main cause is the coronary artery disease. So the risk factors, there are those that we can modify, there are those that we cannot modify. Age, we do not have control on our age. The moment we are alive, we are going to age. So this is a non-modifiable risk factor. We cannot do anything about it. Male gender, I've mentioned earlier that the males are more predisposed to myocardial infarction. We do not have control over the family in which you are born into. So family history is an important risk factor, which is non-modifiable. Then male pattern baldness has been added as as a type of minor risk factor. Then we have those that we can modify. The reason I try to divide it into this is for us to know that we have so many things that we can handle when it comes to the prevention, and hence we should be able to know that there is so much Allah has put into our power that we should be able to do in order to prevent myocardial infarction. One of it is hypertension. One of the tests that we had this morning was that of blood pressure, and alhamdulillah, most of the members were also advised on what to do, especially those that are having high blood pressure. Diabetes mellitus is a disease that we really need to be very careful about. One of my teachers will always say that when you have diabetes, and I will always tell my residents too, you tend to have all disease, because especially when it's uncontrolled. That is not to scare us, because if we control it, there are people that have lived well into the elderly without having problem with diabetes. Hence, we need to take care of this disease. Then this lipidemia. I was talking about cholesterol the last time. Cholesterol is one of the lipids, and when there is an imbalance, there are those lipids that we call good lipids and bad lipids. But the most important thing is for us to have moderation, which is one of the main things that has been encouraged in Islam. So this lipidemia, if we have high level of cholesterol in the body, this may be a problem. Then the age. Men are at higher risk. And here, after the age of 45, actually people that are even 40, you can have people that can also be a risk factor. But after the age of 45, we have realized that mainly this is a disease that can occur among the Ansar. And then women, age of 55. So that gender disparity is so much. However, when it gets to the age of 70, these tend to converge. Then psychosocial stress is one of the things that we need to be very careful about, especially with the prevailing economic and social circumstance within our country. However, if we find solace in Allah, and at least from the previous lecture, we realize that as Muslims, we need to find solace in Allah. All these are things that can really be handled, because psychosocial stress are things that we tend to overlook. And even among members, So it is important that we need to gather ourselves together. This also is one of the lectures, I think, in the syllabus for health. So we need to really handle this very well, get a lot of sleep, have discussion with people, socialize a lot. One of the things we are doing now, coming to gathering, and the Jama'at has given us ample opportunity to be able to handle psychosocial stress. And so I think we should avail ourselves of those opportunities. And also, very importantly, we need to get quality sleep. We need to get quality sleep, which is also a risk factor and is also linked to psychosocial stress. I know smoking may not be exactly prohibited in Islam, but it's one of the things that if you don't do, you get reward for. Hence, and it's like when somebody, though I do not expect that we have members, especially Ansar members in the Jama'at, that are indulging in smoking. Apart from myocardial infarction, it is something that is a risk factor for a lot of things. And when you talk about a cancer and you ask a medical student to name a risk factor, even if he doesn't know anything and is able to mention smoking, is most likely to be correct. Hence, this is something that we need to be very careful about. And when we are talking about coronary artery disease, is one of the very important modifiable risk factors that we can handle. So for members or for I think it's unlikely for us to have members, but for people that are involved or indulge in cigarette smoking, it is very important that, and especially for those people that have smoked for a long time, we have people that from MAJLIS Kudam or from youth, from young age, they start smoking up till elderly. So it is a very important risk factor we need to run away from. Alcohol, this is completely prohibited in Islam, and like Dr. Oni mentioned yesterday when he was talking about the risk factors to chronic liver disease, it's not expected that we should have members of the Jama'at that are indulged in alcohol ingestion. Hence, we do not expect this to be part of the problems that we face. Then family history, I've mentioned that is non-modifiable. Then previous history of myocardial infarction. In a way, for someone that has had myocardial infarction before, this becomes an unmodifiable risk factor for him. So he cannot modify, he cannot change what he is. So use of psychoactive drugs like cocaine, amphetamine, and ephedrine. When somebody really wants to, there are some of us that maybe students, not necessarily students, there are even people that are skilled workers that may want to remain awake at night and indulge in some psychoactive substances. This can be very dangerous. So clinical presentation, I think this is one of the myths of the presentation. Clinical presentation, one of the main and important clinical presentation is pain. I've mentioned why we have pain. Anytime blood does not flow to any part of the body, some of us that have had fractures before, we have a relation that has had fractures, if they put a POP, they will tell you that the moment that person is crying or the moment the person is in pain, you should rush down to the hospital. That is ischemia. That means blood is not getting there and pain is protective. How is this pain? This pain is usually in the central part of the body. It could be sharp. It could be constricting. Usually somebody will just put his hand on the chest and do this. I have pain here. And that pain is usually very severe and lasting for almost like 30 minutes or even more. And that pain may also be burning, but rarely. So the pain also radiates. What radiation means is that as you are feeling that pain, you are also feeling it somewhere else. Feeling the pain around the neck, left part, and then the jaw, and then radiating down to the part of the, that is down to the shoulder and down to the left arm, like that. So a pain that begins in the chest, central chest, and goes down, jaw, neck, shoulder, and down. So this is most likely as a result of myocardial infarction. Some people may have this pain in the upper part of the abdomen and may feel like whatever they have eaten is not digesting, cannot digest. So they may feel some sort of fullness. However, this is not a common presentation. The one I mentioned is the main common presentation. A pain in the central part that is sharp, usually constricting. You feel as if the chest is tight and it goes down to the jaw, up to the jaw, neck, and the shoulder, and the arm. Now, there are important investigations that are usually done, and there are things that the doctor can pick up. I don't think we really need to dwell on that much. One of it is electrocardiography. You just put electrode in the chest and see some readings. Some of us that have visited the doctors for checkup before, especially those people that are hypertensive, may have had electrocardiography done. Then cardiac enzymes, echocardiography, that's the ultrasound that looks into the heart. It sees what is really happening, the way the heart is beating, what are inside the heart, and could say how the heart is pumping, to which percentage the heart can pump. So all these can be done. Chest x-ray, random blood sugar. Why we are saying random blood sugar here is that if the patient presents at emergency, it's not likely to be fasting blood sugar. But if it's not emergency, it's a fasting blood sugar that will be done. So that's why I mentioned here that random blood sugar, then hemoglobin A1C, to test how has this person been controlling diabetes. And I mentioned that fasting lipid profile, of which cholesterol is one of the lipid that will be tested. Then electrolytes, urea, and creatinine. How is this person's kidney functioning? Because patient may actually have hypertension, which can be as a result of kidney problem. Then how do we treat this? Again, this may not be of much problem to us, but it's important for us to just know that the doctor may give us a painkiller like morphine. And then there is something that is called vasopressin. I'm sure most of us also take it. We take it at low dose for prevention. But when it comes to treatment, it's given as high dose. That is an antiplatelet. It's also known as, the real name is aspirin. Then oxygen can be administered, nitrates, and then statins, thrombolysis, then percutaneous coronary intervention. This is usually, well, I'm not sure we have hospitals that do this readily. And this is one of the reasons that the outcome in the Western world may be better than ours. Because if patient arrives in the hospital 90 minutes before, at the time he has a myocardial infarction, they may probably be able to do this coronary within 90 minutes. 30 to 90 minutes, they may be able to do this percutaneous coronary intervention and salvage that part of the heart. However, if this does not happen, then that part of the heart will die, which is called myocardial infarction. Then one will treat the cause. If the cause is as a result of uncontrolled hypertension, that will be treated. Uncontrolled diabetes, that will be treated, and so on. Then, how do we prevent myocardial infarction? I think this is where the meat of the presentation is and where we think we have power to do a lot. So we need to identify any possible cause. Like I mentioned to us, hypertension is a culprit. Diabetes mellitus is a culprit. Poor lipid control is a culprit. So, in subsequent distance, I've mentioned, maybe I should just take the two together. In order to handle this, we need to continue to control high blood pressure. There is a norm that people will say that is not norm, but people are turning it into norm, that if I have hypertension and I've taken drugs for a while, somebody will say, money hypertension tele, that I used to have hypertension, but I've used drug for it. I no longer have hypertension. If really that person had hypertension, then it's for life, except in those people that there is a primary cause and that primary cause has been corrected. But the common one that is essential hypertension, the moment that person is hypertensive and he has to be on drugs. The same thing with diabetes. Somebody will say that I used to have diabetes, I no longer have diabetes. It doesn't happen. The moment you have diabetes, you have diabetes. what you should just do is to take it as the will of Allah and continue to control it. Yes, there are so many people out there that says that herbs can treat this thing. I do not condemn that completely. But what I always tell people is that if you are sure you are taking herbs, which some of us will be a bit skeptical about, always go to the hospital to do checkup to be sure that this thing is under control. If it's not under control, then whatever you are taking is not working. And we have seen that prevention is the main thing in myocardial infarction. I've painted the picture to us about how life-threatening it is. What is the survival rate before getting to the hospital? That is, all these are in areas where the healthcare facilities are optimum, not like what we have in our country. Hence, for us, since we know that we have suboptimal facilities, so it is important for us to lean towards this prevention and try to adhere to some of the preventive technique and prevent it. So if one has this, it is important to do, even for someone that is not hypertensive, the moment one is above the age of 40, yearly checkup of blood pressure is important, at least every year. And alhamdulillah, I think if one attends the program of the Jama'at, he will avail himself of this opportunity. However, it is not right only to say that it is when I come to the program of Jama'at alone that I will do this, because sometimes you may have exert yourself. So any reading we are taking may not be right. Hence, it is important to take it at home where you are. Try to see, is this blood pressure correct? If it's not correct, is this blood pressure normal? If it's not normal, it is important to see the doctor and be placed on medication, and hence yearly or regular follow-up so that can be kept controlled. The other one is diabetes, which I've also mentioned. It is important, even when someone is not diabetic, it is important to do a yearly checkup. And for people that have family history, it is important to do it earlier. For people that have high cholesterol level, it is also important to check within a year or two at least, what is my level of cholesterol? Is this normal? The moment it is deranged, it is important to always visit the doctor and make sure that this is always corrected. We've talked about smoking and alcohol. Hence, in the prevention, it is important to stop smoking and alcohol. Then regular exercise. The word here is regular. It's not the kind of exercise we do at programs. We just say, okay, let's do exercise, and we do exercise, and we get home, we stop doing it. It is important to make it regular. And what is regular exercise? At least we need to be objective when we say this. Because when somebody does not know, you would think that it's just for him to walk around and sit down. That may be exercise. Some people would think that I need to walk very far or run very fast. One thing with exercise is that it is individualized. We do not advise someone that is 60, 70 and above to go and be running around. Like I mentioned earlier, that one of the things that can happen to the heart, even when the vessels are not narrowed, it is because as one grows up, the vessels generally get narrowed anyway. So it is when somebody exerts himself beyond his capacity. So that's why it is said that exercise is individualized. What you think your capacity can handle. And you will always know. Somebody that runs so fast and see that he's still having lightheadedness, you should know that then the heart cannot really cope. The exercise that we usually will do for 150 minutes, if one takes a brisk walk every week, that is every week, you calculate the number of minutes in a week, 150 minutes. Maybe you have a compound, you can just walk briskly, not the kind of gentle walk, brisk walk. That may amount to an exercise that an elderly person can do. For someone that is younger, can run 75 minutes in a week, and this may be enough for that person. Then eating hearty meals. But I think the time is almost up, so I need to quickly rush. Most of us have read the philosophy of the teaching of Islam, alhamdulillah. So the Prophet ﷺ actually talked a lot about moderation. And then we need to do things in moderation. I think that is one of the things that I will say here. most countries have things that they say. One of the countries use dietary approach against in stopping hypertension. So that's constitute things like taking a lot of vegetables, lean meats, like you are taking chicken, white meat, but you have to take out the skin. So these can help. And then less fatty meat. Then fish, especially the scaly fish, very important. These are very good, though we know that things are difficult now. But we have some other things, though beans is also expensive now. But beans is something you can take, it's good. Vegetables, these are also good. And then fruits. These are things that are very important, especially for the elderly, to help to control some of these risk factors. Then we need to maintain healthy weight. A BMI of less than 25 is very important for everyone. And then one need to run away from truncal obesity. What that means is that having a large, big trunk, which is common among men than you see in women. So then I've mentioned the stress issue, and then we have to get quality sleep. So in conclusion, myocardial infarction is a serious life-threatening condition that is better prevented than treated. Hence, we need to really talk about that prevention a lot. And alhamdulillah, I think we all have our cell phone. You can just check prevention of myocardial infarction. We can still learn more. And again, if we are just taking some of the things we have said here, it is also very important. Exercise is very important. Meal is very important. Check blood pressure. Control stress. All these are very important. So a good knowledge of the clinical presentation can help with early presentation, early diagnosis, and prompt treatment. So if we have some of the clinical presentation, some of the symptoms we have said, some of the symptoms that have been said here, if we notice those, we can present, because the prognosis can be improved. That is, the outcome can be improved if we present early. Mo fẹ́ sọ ní ṣókí àwọn nǹkan tí mo sọ ní èdè Yorùbá. In tí wọ́n fún mi pé kí n sọ̀rọ̀ lé lórí òun náà ni myocardial infarction. Èyí tó túmọ̀ sí àwọn iṣan ọkàn tó kú. Ní síwájú mo sọ pé ọkàn fún rẹ̀ òun ló ń fún gbogbo ara ní ẹ̀jẹ̀ tí tó fi mọ́ ọpọlọ wa. Òun náà ló ń fún lẹ́jẹ̀. Ṣùgbọ́n bó ṣe ń fún wọn lẹ́jẹ̀, òun náà nílò ẹ̀jẹ̀ fún rẹ̀ láti lè rí i pé afẹ́fẹ́ tó ń bẹ nínú ẹ̀jẹ̀ yìí ti ṣe oxygen àti àwọn oúnjẹ mèremère tó ń bẹ nínú ẹ̀jẹ̀ tára ti fọ́ wẹ́lẹ́wẹ́lẹ́ láti lè dé ọkàn yẹn, láti lè jẹ́ kí ó ṣe, nítorí iṣẹ́ ńlá ló ń ṣe. Tí iṣan ọkàn bá dúró, ó túmọ̀ sí pé ẹni ọ̀hún ti kú nìyẹn. Iṣan ọkàn òun náà ní iṣan kan lára tó jẹ́ pé kò í dúró, ó ń ṣiṣẹ́ lọ láéláé ni. Ṣùgbọ́n bó ṣe ń ṣiṣẹ́ yìí náà ló ṣe nílò afẹ́fẹ́ inú ẹ̀jẹ̀ àti oúnjẹ inú ẹ̀jẹ̀. Àwọn ọ̀pá tó wá ń gbẹ́jẹ̀ wá síbi àwọn iṣan yìí fúnra wọn tó ń bá dí, ó lè fa pé kí àwọn iṣan tó ń gbé ẹ̀jẹ̀ sí ara kó kú. So tí eléyìí bá ṣẹlẹ̀, tí ó lè ṣe kó já síkú tí tó bá ti kọjá agbára ọkàn yẹn. Ìdí ẹ̀ ló fi fà tó jẹ́ pé a ń láti ṣọ́ra ká wo kí ni àwọn nǹkan tí a lè ṣe láti lè fi dẹ́kun àwọn nǹkan tí ó ṣeé ṣe láti fa ipe kí iṣan tó ń gbẹ́jẹ̀ sí ọkàn kó má dì í. Mo ṣàlàyé fún wa ní ráńpẹ́ nípa bí kíní ṣe wọ́pọ̀ sí. Ó wọ́pọ̀ ju bí a ṣe ń lérò lọ. And ọ̀pọ̀lọpọ̀ àwọn èèyàn tí kíní bá ṣẹlẹ̀ sí, ìlàjì nínú ìdá 100 ló lè gbabẹ̀ lọ kó tó dé ilé ìwòsàn. Nǹkan tí ó ń fà gangan, mo ṣàlàyé fún wa wípé òun náà ni ọ̀pá tó ń gbẹ́jẹ̀ wá síbi ọkàn tó bá dí. Ṣùgbọ́n kí ni àwọn nǹkan tó lè fa eléyìí? Àkọ́kọ́ ìkànnú ẹ̀hún náà ni hypertension, ẹ̀jẹ̀ ríru. Ó lè fa eléyìí. Gẹ́gẹ́ bá a ṣe àwọn ìfúnpá fún wa, mo dẹ̀ sọ pé ká gbìyànjú láti máa ṣe àwọn ìfúnpá yìí lóòrèkóòrè ká bàa lè mọ̀ pé bóyá a ní ẹ̀jẹ̀ ríru àbí a ní, ká bàa lè mọ̀ nǹkan tá a máa ṣe sí. Àìsàn ìtọ̀ ṣúgà eléyìí náà wà ń bẹ̀. Then ẹni tí ó ń sanra tó kàn sanra jù, bóyá èèyàn sanra ju bó ṣe yẹ lọ, gẹ́gẹ́ bí dókítà ní ṣe sọ lánàá pé ìyẹn bí ẹni pé kò wọ́pọ̀ láàrin wa nínú jàmáà. Ó túmọ̀ sí pé à ń jẹ nǹkan dáadáa tó yẹ ká máa jẹ. ṣùgbọ́n bóyá a sì lè rí èèyàn kọ̀ọ̀kan báyẹn tí ò jẹun tí ó yẹ. Then ọjọ́ orí jẹ́ kankan tó yẹ pé a ní agbára lórí, tíyẹn bá ti wà láyé yóò mọ̀ bó sí ni. So ẹni tó bá ti pé bí ọdún 45 ó ti ń ní tójọ́kùnrin o, ó ti ń ṣe é ṣe fún láti lè máa ní eléyìí, tó ń túmọ̀ sí pé èèyàn láti ṣọ́ra. Láàrin àwọn obìnrin ó tún wá retí bí ọdún 10 díẹ̀ sí kíru eléyìí tó lè ṣẹlẹ̀ sí wọn. Then ẹni tó ń fa sìgá, eléyìí ṣe nǹkan tí ó dáa, àti pé kí èèyàn máa gbé nǹkan lọ́kàn. Gbogbo àná la mọ̀ pé àsìkò yìí ó rí bákan, ṣùgbọ́n ká rí i pé Ọlọ́run náà ló mú àsìkò yìí wá, òun náà ló máa mú lọ. Kí a ṣe sùúrù gẹ́gẹ́ bí Ọlọ́run bá ṣe sọ fún wa nínú Al-Qur'an, a ń láti ṣe sùúrù. Sùúrù tá a bá ṣe yìí, òun náà ló máa jẹ́ kí ọkàn wa kí ó wà ká fọkàn balẹ̀, kí àìsàn tí ò ṣe tiwa kó ba lè má wọ ara wa. Ẹni tó bá ní nínú ẹbí ẹ̀, ẹlòmíì lè wà tó yẹ pé a kàn sọ pé bàbá òun jí lóru, wọ́n dẹ̀ gbàbẹ̀ lọ, ó ṣeé ṣe kó jẹ́rù nǹkan báyìí. So ẹni ọ̀hún láti ṣọ́ra. Àbí ẹni tó ń mọtí, a dẹ̀ sọ pé àròyìn inú àwùjọ wa yìí, ṣùgbọ́n dókítà ní sọ pé àwọn ẹlòmíì máa ń yọ ọmú, wọ́n á sọ pé wọ́n fi sínú àgbo. Eléyìí èèyàn ń yọ ọmọtí ni. So eléyìí dẹ̀ lè ṣe àkóbá fún yàn, yàtọ̀ sí oríṣiríṣi àkóbá táwọn náà tún mẹ́nu bà ní àná. Then àwọn oògùn olóró mi náà wà tí èèyàn lè lò tó lè fa irú eléyìí. Àwọn nǹkan tí èèyàn báwo ni ẹ ṣe lè mọ̀, òun náà ni mo sọ pé ẹ rí i pé mo gbọ́ lórí àyà mi lẹ́ẹ̀kan. Èèyàn lè máa bẹ̀rẹ̀ sí ní dúdùn ní àyà tó yẹ pé á máa dùnyàn gidi gan, kì í ṣe díẹ̀ o, tí á dùnyàn gidi gan, tá dàbí ẹni pé gbogbo ẹ̀yìn ó ń le, ó wá ń kànyàn. Ìgbà míì ó máa kànyàn wọnú tó yẹ pé èèyàn á bẹ̀rẹ̀ sí ní mọ́ ní ọrùn wá síbi apá nílẹ̀ báyìí. Eléyìí ó ṣeé ṣe kó jẹ́ myocardial infarction tá à ń sọ̀rọ̀ ẹ̀ yìí, tó dẹ̀ jẹ́ pé àìsàn ọkàn tó máa ń pààyàn ní òjijì. Ìgbà míì wà jẹ́ pé a máa gbọ́tà kan tí àyà wa, ọkàn wa ń bẹ̀rẹ̀ sí ní tó ń beat, tó máa gbùgbùgbùgbù báyìí, eléyìí lè fà á. Ìgbà míì wà jẹ́ pé ó lè ṣàdédé rẹ̀yàn àbí kí orí èèyàn fúyẹ́, àwọn eléyìí ó lè fà á. Ẹlòmíì ó lè jẹ́ ikọ́, ẹlòmíì gan mímí ẹ̀ lè bẹ̀rẹ̀ sí ní lọ. Ṣùgbọ́n àwọn eléyìí á láti kó papọ̀ mọ́ dídùn àyà yẹn. A ní àwọn ẹnìkan wà tó yẹ pé wọ́n lè mọ̀ pé àyà ń dùn àwọn. Mo dẹ̀ ṣàlàyé àwọn ènìyàn, ó lè jẹ́ àwọn ẹni tó bá wọ́n ní diabetes fún àsìkò tó pẹ́, so ìyẹn ó lè fà á. Ẹlòmíì wà tó yẹ pé ó ti dàgbà gidi gan, kò tiẹ̀ mọ ibi tóun wà, ó lè máa nírú yẹn kó má mọ̀. Ṣùgbọ́n a sọ pé èyí tí ó ṣe pàtàkì ń bẹ jù, òun náà ni báwo la ṣe lè dínà àwọn nǹkan yìí. Òun ni pé ká wò pé kí ni àwọn nǹkan tó lè fà á. A sọ ẹ̀jẹ̀ ríru, a sọ àìsàn ìtọ̀ ṣúgà, a dẹ̀ sọ àwọn àìsàn ọ̀rá inú tó yẹ pé èyí kan wà tá à ń pè ní cholesterol, tó yẹ pé ó lè high jù, ó lè pọ̀ jù, tó lè fà á. Then a sọ ti sìgá mímu, pé kíyàn dínà sìgá mímu kó má mú mọ́. Ti àìsàn ẹ̀jẹ̀ ríru, a ti sọ fún wa pé ó ṣe pàtàkì láti máa ṣe check up. Fún ẹni tí ò bá tiẹ̀ tí ì ní gan, tó bá ti dé 40 ọdún, ó ti di dandan láti máa check ẹ̀ at least ó kéré tán ẹ̀ẹ̀kan lọ́dún. Bẹ́ẹ̀ náà ni ti ṣúgà àti ti ọ̀rá inú ẹ̀jẹ̀. Exercise ó ṣe pàtàkì, nítorí ẹ̀ ní wọ́n fi máa ń kọ́ wa ní oríṣiríṣi ìpàdé wa láti máa rìn. Fún ẹni tó bá ti dàgbà, kó rìn ńlẹ̀. Tó bá lè ka wákàtí 150 minutes, that is 150 lé ní 100, 150 àti 100, 150 wákàtí 150 ní ọ̀sẹ̀ kan. Fún ẹni tí ó fẹ́ tó lágbára láti sáré fún bí 75 minutes ní ọ̀sẹ̀ kan, ìyẹn ṣe pàtàkì. Kí lẹ wí sà? Okay sà, wákàtí kan àti ìṣẹ́jú 15 ní bẹ́ẹ̀ ni sà, ní ọ̀sẹ̀ kan. A pín wẹ́lẹ́wẹ́lẹ́ báyẹn fún bẹ́ẹ̀ ni tó bá lè. Ó mìíní pé ó túmọ̀ sí pé bóyá bí wákàtí 15, ó fẹ́ tó wákàtí 10 sí 15 lọ́jọ́ kan. So eléyìí ó ṣe tó fi máa sáré ni o, kì í ṣe fẹ́ni tó ń rìn o. Ìṣẹ́jú bẹ́ẹ̀ ni sà, ìṣẹ́jú. So ká dẹ̀ máa jẹ oúnjẹ tó dáa. Àmẹ́rì ti sọ pé kí n sọ fún wa pé ẹja ó ṣe pàtàkì ṣùgbọ́n wọ́n sọ pé ìyẹn lè wọ́n fún wa a lè wá nǹkan bíi ẹ̀wà dáa ó dáa lára ìyẹn náà tí wọ́n báyìí o ṣùgbọ́n kọ́ lọ́n pèsè àwọn nǹkan bíi ẹ̀fọ́ àwọn ìyẹn náà ṣe pàtàkì kí ọlọ́ba kí ó pèsè fún wa nítorí nǹkan tá a rí là ń jẹ báyìí kì í ṣe nǹkan tí ó wù wá là ń jẹ kọ́lọ́ba kí ó ṣe wá bá a ṣe fẹ́ kí a dẹ̀ máa sùn dáadáa eléyìí ó ṣe pàtàkì fún wa ká dẹ̀ rí pé a tóbi jù ó ní nǹkan kan tá a máa ń wọ̀n tá à ń pè ní BMI tí ó bá ti ń kọjá bíi 25 ó ti ń pọ̀ jù so ká rí pé a ṣe níwọ̀ntúnwọ̀nsì mo dẹ̀ ti sọ fún wa àwọn check-up tí ó yẹ kí a máa ṣe ní ìparí àìsàn yìí ó jẹ́ àìsàn tó yẹ pé ó lè fa ikú òjijì èyí tó dára jù òun náà ni pé kí a mọ àwọn nǹkan tí ó lè fà á kí a dẹ̀ gbìyànjú láti rí i pé a dínà àwọn kìíní kí ọlọ́ọ̀bá kí ó ṣe ní ìrọ̀rùn fún wa. Assalamu alaikum warahmatullahi wabarakatuh.